curves is correct. So first statement is the curve of P runs mediolaterally across the lower arch, right? The second statement says so I guess this class started from somewhere while I had already started discussing the first question. So let me repeat it again. So today we will be discussing some MCQs from dental anatomy, and the first MCQ is the occlusal curvature. In occlusal curvature descriptions, multiple curves are recognized. So which statement regarding these curves is correct? So you have to find the correct statement regarding the curves, right? So first statement is the curve of P runs mediolaterally across the lower arch. Second option says the curve of Wilson is an anterior-posterior curve from canine to the molars. And third statement says the curve of P is an anterior-posterior curve visible when viewing the arches from the buccal aspect. The last statement, both curves flatten significantly during normal protrusive movements. So do you think these curves flatten during the normal protrusive movements? So none of these curves would flatten in any movement, isn't it? The curve of P is an anterior-posterior curve, isn't it? Which goes along all the cusp, all the buccal cusp, starting from canine to all the molars, and then it ends in the condyle. So it's an anterior-posterior curve. While the curve of Wilson is seen in molar region, right? It is seen in molar region, right? It is seen in molar region, and this curve is convex upwards, isn't it? So basically it runs mediolaterally. The curve of Wilson, it runs mediolaterally, and the curve of P, this runs anterior-posteriorly. So option C, that is the curve of P is an anterior-posterior curve which is visible from the buccal view. This is your correct option, right? So apart from these, you have other curvatures as well, isn't it? Curve of monsoon and curve of anti-monsoon. So curve of monsoon is a three-dimensional curve where the center is at the glabella and the sphere has a diameter of 8 inches, isn't it? And the occlusal plane, this is at the surface of this sphere. Whereas curve of anti-monsoon is seen in premolars, isn't it? So curve of monsoon this is a three-dimensional curve, and basically it represents a sphere, isn't it? Which has a radius of 4 inches, isn't it? And the center is at glabella, and the occlusal plane is at the surface of this sphere, isn't it? And similarly we have another curve which is curve of anti-monsoon, and this curve of anti-monsoon, this is seen in premolar region, right? This is seen in premolar region, and it is concave upwards, isn't it? So let's go to the next question. Primary teeth differ from their permanent successors in various ways, right? Which characteristic describes the typical crown proportion difference for the primary teeth, right? So according to the question, what do you have to find out? You have to find out the difference in the crown proportion, which helps differentiate the primary teeth from the alternate teeth. So option A says crowns are generally narrower mesiodistal. They are generally narrow mesiodistally related to their teeth. So what it means is that the occluso-cervical is more than the mesiodistal. That's what option A says. Option B says the cervical constriction is less pronounced. The cervical constriction is less pronounced, giving it a more cylindrical crown form. But we know that the primary teeth, they have this cervical ridge is the characteristic feature of the primary teeth, isn't it? And that's why the cervical constriction also would be more pronounced in a primary tooth as compared to a permanent tooth. So option D is wrong, isn't it? Option C, crowns are proportionately shorter occlusogingivally. So they are proportionately shorter occlusogingivally as compared to mesiodistal, making them appear bulbous, right? So they will appear bulbous. And option D says that the contact areas are smaller and more pointed than in permanent teeth. Now, in deciduous teeth, we often see that there is spacing between the teeth. So there is no contact usually in the deciduous teeth. So option D is also incorrect. Now we are confused between option A and C. Crowns are generally narrow and mesiodistally related. Do you think this option is correct? Do you think they appear taller, or do you think that they appear bulbous? Which of the two statements do you think is correct? Option A, where the crown appears taller, or option C, where the crown appears more bulbous? So it is the option C, because in deciduous the crown appears more bulbous and also they have a lower crown to root ratio as compared to their permanent counterparts or as compared to their permanent successors, right? So successors and counterparts are different, isn't it? Because a molar's counterpart would be molar, but the successor of a deciduous molar would be a premolar, isn't it? So in any case, the primaries have a lower crown to root ratio as compared to permanent teeth, right? And so option C is your correct answer. So let's go to the third question. The mandibular second premolar can exhibit different cusp configurations. So what are these configurations? We can have the central groove in Y or U or H type. So based on that, there is a difference in the cusp anatomy. So which statement is correct regarding these variations? We have to again find the correct statement. So option A says the Y type form has two buccal cusps and one lingual cusp. So do you think the mandibular premolar, the mandibular second premolar has two buccal cusps, or does it have two lingual cusps and a single buccal cusp? So obviously it has the mandibular, the three cusp mandibular second premolar, the three cusped mandibular second premolar has one buccal and two lingual cusps, isn't it? So option A is incorrect. The U-type form exhibits a dominant buccal cusp with a small lingual cusp, creating a C-shaped. Now this groove isn't C-shaped. Basically, what we mean is the central groove is U-shaped and not C-shaped, isn't it? The central groove is U-shaped. And why is it U-shaped? Why is it U-shaped? Let's say these are the marginal ridges and the central groove. This is more or less U-shaped, isn't it? This is more or less U-shaped central groove. The buccal cusp is more prominent, isn't it? The buccal cusp is more prominent as compared to the lingual cusp. So option B is also incorrect. What about option C? The H-type form typically has three cusps and an H-shaped fissure pattern. So again, this option is incorrect. Why? Because in the H-shaped pattern, what happens is when the central groove is The central groove is H-shaped, as you can see here, and both the buccal and lingual cusps are almost same in development, isn't it? And as you can see, there is just one buccal and one lingual cusp, isn't it? So there are not three cusps, but there are just two cusps. So option C is also incorrect. That leaves us with option D. So in the Y type is considered the most common. Yes, it is the most common variant and it features three cusps, two lingual and one buccal, isn't it? It features three cusps, two lingual and one buccal. One buccal and two lingual cusps, right? So option D, that is the Y type, is considered the most common variant featuring three cusps and a Y shape of groove, right? So let's go to the next question. Which of the following statements is most reliable morphological clue to differentiate a maxillary canine from a mandibular canine? Now, what is the key word in this question? That we have to go for a morphological clue, right? Morphological means shape, right? In the maxillary canine and the mandibular canine. So option A says that the mandibular canine cusp tip is often sharper than the maxillary canine cusp tip, right? So have we studied that the mandibular canine is sharper than the maxillary canine? Have we studied that? Yes, we have, but in the primary dentition. So in primary dentition, in primary, mandibular canine is sharper, but in permanent dentition, maxillary canine is sharper, right? So in permanent it is the maxillary canine and in deciduous it is the mandibular canine. So option A is incorrect, right? What about option B? Maxillary canine has a more pronounced cingulum and a lingual ridge. So yes, maxillary canine has features which are more prominent as compared to the mandibular canine, or for that matter any other anterior teeth, isn't it? So this option is, it looks correct, right? So let's go to the other options. Mandibular canine has a shorter crown relative to its root length. So the thing is that mandibular canine has the longest crown of any permanent dentition, isn't it? Of any tooth in the permanent dentition. So mandibular canine has the longest crown, and the length of the mandibular canine is, the crown of the mandibular canine is approximately 11 millimeters. Its root is approximately 16 millimeters. While in case of a permanent canine, the crown is approximately 10 millimeters, whereas the root is approximately 17 millimeters. So as you can see, the relative length of the crown is shorter in the maxillary canine, right? 10 is to 17 millimeters, whereas it is longer in the mandibular canine, 11 is to 16 millimeters. So option C is also incorrect, right? Option D, maxillary canine exhibits a flatter incisal wear facet on the lingual side. So again, this is incorrect. There is usually no wear facet on the canine, right? So option B, maxillary canines are more singular and lingual ridges. All the features are more prominent on the maxillary canine as compared to any anterior, right? So next question, maxillary first and second molars share many traits. They both are molars, they both have three roots, three primary cusps and a secondary cusp, right? Which statement distinguishes the maxillary first molar from the second? So we have to differentiate the first and the second. So option A says it frequently presents a larger distolingual cusp compared to other maxillary molars? Option B, the oblique ridge is typically absent or poorly defined. So oblique ridge is usually present in both first and second molars. It may be absent in third molar. So this option definitely is incorrect. Its noun often tapers more towards the lingual. Tapers more towards the lingual, making the buccal aspect appear narrower. Maybe, right? It may be possible. So it may be seen in some teeth. It is not always. It is not a rule, right? The cusp of Carabelli may be underdeveloped. The mesiolingual cusp may be underdeveloped. So it may or may not be seen, right? It usually lacks the fifth cusp. So again, this is incorrect. It may lack the fifth cusp, but it does not usually lack the fifth cusp. It usually has the fifth cusp, right? So that fifth cusp may be underdeveloped, but it is there on the mesiolingual cusp, right? In some cases, it might be absent, but rarely it might be absent, right? What about option A? It frequently presents with a large distolingual cusp compared to other maxillary molars. Now we just talked about the primary cusp and the secondary cusp, isn't it? So this distolingual cusp is the secondary cusp, isn't it? The distolingual cusp is the secondary cusp, and its size decreases from first to third molar, since it is the secondary cusp. So its size will gradually decrease from first to second to third molar, right? And hence this statement is always correct. So if it is absent in first, it will definitely not be present on second or third molars. If it is present on first, then definitely it will be smaller on second and further smaller on third, or absent on third, right? So the option A is always correct, but option C, that the crown tapers. Why does it taper toward, or why does it diverge towards the lingual side? Because of the mesiolingual cusp. So mesiolingual cusp may not be well developed in all the teeth. It may not have cusp of Carabelli in the teeth. So it may be correct, but it is not always correct, right? It is not present. This trait is not seen in 100% of the cases. Whereas option A, this trait is seen in 100% of the cases, right? So both these statements are correct. Which is better? Is the option A, which is better, right? So let's go to the next question. Just a minute, as I find it again. Yes. So let's go to the next question. Maxillary lateral incisor and centrals can share general features, yet each has hallmark traits, right? Each has unique features, differentiates them from each other, right? So which feature distinguishes the lateral incisor from central? Now we must look for the features of lateral incisor, right? Straighter mesial incisal angle and more pronounced distal incisal angle. So actually, in the lateral incisor, the mesio-incisal angle is sharper and the distal incisal angle is rounded, isn't it? So option A is incorrect. A more prominent cingulum that occupies almost half of the lingual surface. More prominent cingulum, right? Option C says a deeper lingual fossa with possible lingual pits or fissures. Option D says a nearly square crown with similar mesodistal and incisor, mesodistal and incisor-cervical dimension. Similar mesodistal and cervico-incisal dimension. So mesiodistal and cervico-incisal dimension are same. That is what option D says. But we know that it is wrong. Mesiodistal dimensions are lesser as compared to the cervico-incisal dimension. So we know that option D is incorrect. What about option B? It does have a more prominent cingulum. But do you think it occupies almost half of the lingual surface? So the first part of the option is correct. The second part is incorrect. Right? Its cingulum is prominent, but remember that cingulum of all the permanent teeth is within the cervical third, right? Cingulum of all permanent teeth is with cervical third, and for primary it occupies the entire cervical third. So for none of the teeth, be it primary or permanent, the cingulum reaches middle third, right? So when it doesn't reach middle third, it cannot occupy half of the lingual surface. So for that reason, option B is incorrect. Though it has the first half is correct, the second half is incorrect. A deeper lingual fossa with possible lingual pits or fissure. So yes, it does have a developmental groove. So that groove, it may be deep and represent a fissure. So that is quite a possibility, isn't it? Palatogingival groove or the palatoradicular has that. So that groove ends on the cingulum in a pit, right? So yes, there is a lingual pit or a fossa lingual pit and a fissure. Lingual fossa is already there. The lingual fossa or the other lingual features, be it marginal ridges or the incisal ridges, are more prominent in the lateral incisor as compared to the central incisor. Isn't it? So let's go to the next question. Primary molars differ from permanent molars in multiple ways. So basically there are a lot of differences between the primary and permanent molars. Which statement about the external form of primary molars is true? So basically the morphology of the primary molar, that is what the question is asking about. They are larger in mesiodistal dimension than their permanent successors. They display mini cervical constriction, giving a more cylindrical crown form. So primary molars, as we have discussed in one of the questions before, they have prominent cervical ridges, and for that reason they have prominent cervical constriction, isn't it? So they do not have minimal cervical constriction, but they have a prominent cervical constriction, isn't it? They often exhibit more pronounced cervical bulge. Yes, this is true, and we have just discussed it, especially on the buccal surface. Exactly. Enamel rods in the cervical region incline occlusally, enhancing retention form. So option A, this is a true statement. Option C is also a true statement, and option D is also a true statement. The occlusal, the incisal, the enamel rods in the cervical region, they do, isn't it? They do incline occlusally. So option D is true. Option C is a true statement, and option A is also a true statement. So which amongst these three will you choose? Will it be option A or C or D? For that reason, for that matter, you have to read the question carefully. What the question is asking, isn't it? So the primary molars differ from permanent molars, isn't it? So what we need to do is we need to compare the permanent molars and the primary molars. So we need to find out the feature which compares these two teeth and not the successors, because the successor of the deciduous molars is a premolar, not a permanent molar, right? So option A is comparing the deciduous molar with the premolar, and for that reason this option is incorrect for this particular question, right? Though this statement is true, but it can't be an answer. Option D, it says enamel rods in the cervical region incline occlusally, enhancing the retention form. So that's the general statement for any primary tooth, isn't it? So again, this is incorrect because it does not specifically compare the primary molar with the permanent molar. What about option C? They often exhibit more pronounced cervical bulge as compared to the permanent molars, because in permanent dentition, the molars have a cervical rest. None of the other permanent teeth have any cervical. Cervical bulge is a characteristic feature of primaries, and in permanents it is seen only in molars. So it is the option C which is comparing primaries with the permanent molars, or the primary molars with the permanent molars. So for that reason, we will go with option C over option A or B. Is it clear? So option C compares primary and permanent molars, while option A compares primary molar with premolars. And what about option D? Option D is a general statement, isn't it? So it does not specifically compare primary molars with permanent molars. So next question, the mandibular first premolar can exhibit a snake eyes appearance, isn't it? In its occlusal fossae, which of the following statements below relates to its occlusal form, right? So we need to find a statement related to its occlusal form. A well-developed lingual cusp nearly equal in size to the buccal cusp. We know that the lingual cusp of lower first premolar is underdeveloped and it resembles the cingulum, not the cusp. A prominent transverse ridge that often separates the mesial and distal fossa. So this may be correct. Let's go to other options. A Y-shaped groove pattern with 3 distinct cusps. So this is incorrect, isn't it? Because Y-shaped groove is seen only and if you are talking about premolars, it is seen only in mandibular second premolar, isn't it? And that too when it has 3 cusps. A central groove crossing from mesial to distal fossae unimpeded by the ridges. This again is incorrect because when the grooves cross the ridge, it becomes thin or it becomes insignificant, right? And often we have seen that the buccal cusp is too prominent. So for that reason, we will say that this option D is also incorrect and option B is the most accurate part, isn't it? It has a prominent transverse ridge. And why is this transverse ridge prominent? It has, or you can say that most of this transverse ridge is made up of the buccal triangular ridge, isn't it? So this transverse ridge buccal triangular ridge makes up most of the part of transverse ridge. So the buccal triangular ridge is very prominent in the lower first premolar, right? So in the maxillary third molar, the maxillary third molar shows great variability. Which characteristic is most often noted as a common pattern for maxillary third molar? So which characteristic is most often noted as a common pattern for maxillary third molar? So we have to find out the common pattern in the maxillary third molar. They consistently have 4 well-formed cusps similar to the second molar. So they may look like second molar, they may look like third molar, or they may have a 3 cusp in it. So for that reason, I am doubtful about this option A. So let's put a question now. They can exhibit a heart-shaped occlusal outline with a reduced or absent distolingual cusp. Yes, this is a more common anatomy. They often show the largest crown dimension among the maxillary molars. This is absolutely incorrect. The largest crown dimension would be that of first molar, isn't it? From there, the size of the crown gradually decreases from first to second to third. Their roots are uniformly fused into a single continent. They have the greatest tendency for fusion of the roots because the roots are most converging, but they are not always fused. They may be because they have the highest chance of fusion, right? So again, this is incorrect. So we'll go with option B, that they can exhibit a heart-shaped occlusal outline, isn't it? Where the distolingual cusp is either absent or it is fused with the mesiolingual cusp, right? So either the distolingual cusp is absent or fused with mesiolingual cusp. So whether you say mesiolingual or mesiopalatal, distolingual or distopalatal, it's the same. Don't worry about that, right? So if someone asks you how many lobes does this maxillary third molar form from, the 3 cusped, maxillary third molar. So how many lobes is it from? So do not say that it is formed from 3 lobes since it has just 3 cusps. The distolingual cusp, be it absent, be it fused with mesolingual cusp, doesn't matter. It will still be formed with 4 lobes. Right? It is formed by 4 lobes. So either one of the lobes did not develop properly or it was fused with another lingual lobe. So in any case, there will be 4 lobes. So either it did not develop, that's why we do not have the distolingual cusp, or it got fused with the other lingual cusp, and that is why we have 3 cusps. Right? Question number 10. Maxillary first and second premolars share general shape. So the general shape is almost similar, isn't it? But they differ in certain key features, right? Which statement describes a way to distinguish the maxillary first premolar from the second? So we have to find the statement which helps us distinguish the first premolar from the second. So the first premolar usually has equal size buccal and lingual cusps. This feature is more characteristic of the second premolar and not of first premolar. So in the maxillary second premolar, the buccal and the lingual cusps are more or less of the same size, right? But not in the first premolar. So option A is incorrect. The second premolar often exhibits 2 root branches, while the first is typically single rooted. Again, this is incorrect, right? So upper 4, buccal cusp is larger. Also, it has 2 roots, buccal and lingual, whereas the upper 5, the buccal cusp and lingual cusp, they are of almost same size. They are of almost same size, and it has a single, right? It has a single loop. So both options A and D are incorrect. The first premolar commonly displays a mesial developmental depression extending onto the root. So yes, first premolar, right? The first premolar, it does have a developmental depression on the crown, and this developmental depression continues onto the root, isn't it? And there is also a there is also mesial margin which joins from the marginal ridge to this developmental depression, and this is the mesial marginal, isn't it? Mesial marginal. So option C is correct. What about option D? The second premolar has a longer round outline than the first. So this option obviously is incorrect because second premolar has a rounder outline. Second premolar appears more rounded, isn't it? Second premolar has a rounded outline, isn't it? And the first premolar has sharp angles. Clear? So let's go to the next question. In ideal tooth alignment, embrasures and contact areas serve important functions, and we know of it, isn't it? Which statement highlights the typical shape or role of embrasures? So which statement is correct regarding their role or their shape? Right? Option A, embrasure only occur on the occlusal or incisal side of the contact and never on the cervical side. So this is obviously incorrect because we have 4 types of embrasures: incisal or occlusal and gingival, and similarly facial and lingual. So we have 4 embrasures. Facial and lingual embrasures are usually equal in size for posterior teeth. Again, this option is incorrect because it is the lingual embrasure that is often larger as compared to the facial embrasure. So lingual embrasure is larger than facial embrasure except between first molar and second premolar in maxilla, right? Now, since the first molar has a mesolingual cusp, because of which the lingual surface of this tooth becomes broader as compared to the buccal surface. That's why the lingual embrasure becomes smaller as compared to the facial. So, otherwise, lingual embrasures are larger as compared to the facial embrasures. Right? Option C, cervical embrasure or the gingival embrasure help form a spillway for food away from the gingiva. So, this cervical embrasure or the gingival embrasure helps guide the food away from the gingiva. So, option C is correct. The contact areas become more apical from anterior to posterior, eliminating embrasures in the posterior region. So, the first part is correct, right? The contact areas become more apical from anterior to posterior. So, this part is correct, but they do not eliminate the embrasures in the posterior region. The lingual embrasure, cervical or the gingival embrasure becomes gradually smaller as we move from the anterior to the posteriors, but it is not eliminated, right? So, option D is also incorrect because gingival embrasure is found on all the teeth. So, what is the next question? The cemento-enamel junction shows variable curvature on the different surfaces, buccal, lingual, mesial, distal, right? So, on the mesial and distal sides, it curves towards the incisal edges or the surface. So, let's say this is an anterior tooth. So, on the proximal side, cemento-enamel junction it curves towards the incisal surface, whereas on the facial or lingual surfaces, it curves towards the apex or towards the root, right? So the cervical line curves more on the distal surface than on the. So this option is incorrect because this curvature is more or most prominent on the mesial side of the tooth, right? It is more prominent on the mesial side of the tooth. The mesial surface generally shows a greater incisal curvature than the distal. So yes, this option is correct. CJ curves in curvature is uniform all around the tooth. Again incorrect because this is variable. The posterior teeth show more CEJ curvature than interior teeth overall. Again, this is incorrect because interiors will show more curvature as compared to posteriors, right? So the next question: proximal contacts in anterior teeth are important for aesthetics and function. Proximal contacts are important for aesthetics and function. Which statement about these proximal contacts is correct? In the anteriors, right? So we need to talk about the anteriors. Option A says maxillary central incisor usually contact each other at the incisal edge with no embrasure space. So this option is incorrect because the contact at the incisal edge is seen in mandibular central incisors, right? Mandibular central incisors. So contact is at incisal edge, and that's why lower central incisors, smallest incisal embrasure, they have the smallest incisors, right? The contact between the maxillary lateral incisor and maxillary canine is located closer to the cervical line. So always remember that in any tooth, like in any tooth, the mesial contact would be higher and the distal contact would be lower, right? So mesial contact would be higher and distal contact would be lower, higher in occlusion or lower in occlusion, right? So option D says that the maxillary canine with the contact of lateral incisor with the maxillary canine on the distal side is more cervical. The contact between maxillary lateral incisor. Why I am saying distal side? Because on the maxillary lateral, its mesial contact would be with the central and the distal contact would be with canine. So in this statement, though the distal is not mentioned, it is mentioned that the contact we are talking about is between lateral and canine. So it automatically becomes distal. So contact between maxillary and situated closer to the cervical line. Option C, proximal contacts are always at the same level mesially and distally on the same tooth. So again, this is incorrect because they are at different levels. Mesial is higher, distal is lower. Gingival embrasure, and there is a exception to this rule that mesial is higher and distal is lower. What is the exception? The contact between lower sentinel incisors is at same level mesial and distal. Right, so both mesially and distally they are at the same level. Option D, gingival embrasures are absent between anterior teeth with tight contacts. So gingival embrasures are in fact larger in anteriors as compared to the, I wouldn't say larger, but they are higher, right? Their cervico-incisal dimension is greater in anteriors as compared to the posteriors. Since the contact is more incisal in the anteriors, and as we move posteriorly, this contact becomes more and more in the middle third. Whereas in the anteriors, it is moving up to the incisal third or at the junction. Whereas as we move posteriorly, the crown height also decreases and the contacts also move apically. That's why the gingival embrasure it shortens, right? It shortens in height. So next question. While most mandibular molars have two roots, mesial and distal, a third root, a three-rooted mandibular molar can occur as an anatomical variation. So which statement is most accurate regarding this? We have to find out the statement that is correct for this three-rooted mandibular molar. So option A is it typically involves two mesial roots and one distal root. So this option is definitely incorrect because the extra root would always, or let's say would more commonly be a distal root, right? It would not be a mesial root, it would be a distal root. It is only found in mandibular first molar, never the second. So again, it is incorrect. It may be found on any molar, right? So option B is also incorrect. The extra root is often a distal lingual root, and sometimes it is called radix entomolaris, right? It is called radix entomolaris, and this option is correct because the extra root is often distal lingual, and it is named radix entomolaris. This variation is extremely rare and has no clinical relevance in endodontics. So again, it is incorrect. It is not rare, and definitely when a 30% is significant, isn't it? तो एक और रूट कनाल करते हैं. Maxillary anterior teeth have characteristic lingual anatomy. Which statement about their lingual features is correct? So we have to talk about the lingual features of maxillary anteriors. They display a pronounced lingual ridge, dividing the fossa into two halves. So do we always have a which divides the lingual fossa into two halves? And the answer would be no, because the lingual ridge is often present in the canines and not on the incisors. So option A is incorrect. They have a shallow lingual fossa bounded by marginal ridges and a cingulum. So yes, they have a lingual fossa and it is bounded by marginal ridges. It might be shallow, it might be, we do not know, right? So let's put a question mark. They show multiple lingual pits near the cervical line and normal band. This definitely isn't it? Because there are not multiple fossas. If at all, multiple lingual pits. If at all, there will be a single lingual pit, and it is commonly found on the maxillary lateral incisor. It is not found on all the anteriors, right? They lack cingula. So if we read just this much, we can say that it is incorrect, right? Because all the anteriors have cingula, which distinguishing them from mandibular. Obviously, this is incorrect, right? So option B is correct. They have a shallow lingual fossa bounded by marginal ridges plus cingulum, right? So we were doubtful about the option B because we thought that it might have a shallow lingual fossa, it might have a deep lingual fossa, because what we have read is that canines have a deeper lingual fossa as compared to the centrals, or laterals have a deeper lingual fossa as compared to the centrals, right? And the deeper lingual fossa on the canine is divided into two, that is medial and distal, by the lingual ridge. But when you take a look at these options, we will notice that option A is definitely incorrect, option C is definitely incorrect, option D is definitely incorrect. Option B, it seems partially correct. So again, as I have told you many times, that solving an MCQ is not about finding the correct answer, but it is about finding the best choice, right? So which amongst these would be the best choice? So let's say all of these options are incorrect. Option B is partially correct, or we can say partially incorrect, right? So in any case, option B is better than remaining options, isn't it? So that's why we'll go with option B. Similarly, you might sometimes have options that are all correct, but again, you will have to look which option is best amongst those, right? So solving MCQ is not about finding correct answer. It is about finding the best option. So question 16. Which of the following statement about occlusal table's proportions is most accurate? So what is an occlusal table? Let's say this is a mandibular molar. This is a mandibular molar proximal view, right? So the buccolingual dimension would be this. This is the buccolingual dimension of the tooth, right? But what is the occlusal table? It is the area enclosed between these cusps. This is occlusal table. The functional area of the where we will chew, right? Chew your food, right? So it is the area bounded by the body and cusps, right? So it is the area bounded by cusps and marginal ridges. Clear? So that is your occlusal table. Now let's take a look at the options. The occlusal table is almost full buccolingual width and molar. So as you can see in this diagram, there is a huge difference between the full buccolingual width and the buccolingual width of occlusal table, isn't it? So option A is incorrect. In a healthy adult, the occlusal table constitutes about 50 to 60% of the total buccolingual dimension. So yes, it does look like 50 to 60%. When you compare these two, it does look like 50 to 60%. So it's correct. Premolars have a large occlusal table ratio than molars. No. It is a general rule which will apply to all the teeth, isn't it? Premolars and molars both included. Occlusal tables are narrower in maxillary arches than in mandibular arches. Again, this is incorrect. As I just said, whatever statement it has to be, it would be a general statement which will apply to all the posteriors, right? So option A, C and D are definitely incorrect. So that leaves us with option B. And option B is correct, right? Because the occlusal table constitutes about 50 to 60% of buccolingual dimension in the permanent teeth. The occlusal table would be further narrower in the primary teeth. Like the occlusal table is narrower in primary as compared to permanent, right? So let's go to the next question. Which of the following statements is the easiest morphological cue to tell the lateral incisor from the central incisor? So here they have not mentioned whether it is maxillary or mandibular. So let's take a look at the options. The central incisor has a distal lingual twist at its incisal edge. So be it maxillary, be it mandibular, none of those have a distal lingual twist. It is the lateral incisor which has a distal lingual twist, right? So option A is incorrect. Option B says the lateral incisor's crown is perfectly symmetrical with equally sharp angles. Now we don't have a maxilla, we don't have a mandible, and even if we did have maxilla or mandible, still option B would be incorrect because the lower central incisor is the most symmetrical, not the lateral incisor, be it maxillary or mandibular. Option C, the lateral incisor has slightly more rounded distal incisal angle and a subtle distal twist. This statement does appear correct because be it maxillary, be it mandibular, the distal incisal angle is more rounded as compared to the axial angle, or if you compare it with the angles on the central incisor. So in any case, it is more rounded. So yes, the first half is correct. And subtle distal twist. Yes, the maxillary and the mandibular lateral incisor, they both have a distal twist. So this option does appear correct. There is no size difference. Both are identically proportionated. So central and lateral, be it maxillary or mandibular, they are not identically proportionated, right? So option D is also incorrect and option C is correct. Clear? So both the maxillary or mandibular lateral incisors have a rounded distal incisal angle as compared to other incisal angles, and they do have a twist distolingually. The mandibular first premolar has distinct morphology. Which statement below is most accurate regarding the mandibular first premolar? So regarding mandibular first premolar, the mesial marginal ridge is oriented nearly horizontal and is higher than the distal marginal ridge. So have you seen the mandibular second premolar from the mesial side and from the distal side? Though my drawing is not very good, technically you will find it, right? So let's say this is the distal view and this is the mesial view. So this is the mesial marginal ridge and this is the distal marginal ridge. Then we have, right? So what does the first option say? It says that the mesial marginal ridge is oriented nearly horizontal and is higher than the distal marginal ridge. So obviously this does not look like horizontally oriented, isn't it? It does not look horizontally oriented. So option A is incorrect. Distal marginal ridge is horizontally, isn't it? The mesial marginal ridge often slopes apically towards the ligament. So yes, this statement is correct. Option C, both mesial and distal marginal ridges are at the same occlusal level. This again is incorrect because in any tooth, the marginal ridges are at the same level. The mesial marginal ridge is always higher than the distal marginal ridge, except in mandibular first premolar where distal marginal ridge is higher. Right, so in the lower first premolar, the distal marginal ridge is higher. Option D, the mesial ridge typically forms a continuous groove with the central pit. So it does not form a groove with the central pit, right? There may be a mesiolingual groove present on the mesial marginal ridge, but it is not always present. So the mesiolingual groove is not always present, isn't it? So even option D is incorrect. So the correct answer is option B, that is mesial marginal ridge often slopes apically, right? So next question, maxillary central incisors have a prominent cingulum. Which statement regarding the cingulum is true? So we need to concentrate about we need to think about the maxillary central incisors. The cingulum is centered mesiodistally, symmetrically dividing the lingual fossa. So we know that the centered cingulum is present in lower central, upper lateral and upper canine, whereas a distally deviated cingulum is present in upper central, lower lateral and lower canine, right? So what does it mean? That in the upper central, the cingulum is not centered mesiodistally. So option A is incorrect. Option B says it is typically positioned slightly distal. Yes, it is correct. Making the mesial portion of the lingual fossa more spacious. Again, it is correct. Because the distal fossa would appear a little bit smaller as compared to the mesial fossa. So option B is correct. It merges with the incisal edge. The cingulum can't merge with the incisal. Option D, it is significantly smaller compared to the cingulum of the mandibular incisor. It is not smaller than the cingulum of mandibular incisor, right? The mandibular incisors have a smaller cingulum. When comparing maxillary first versus second premolar, their cusps can differ. Which statement most accurately describe this difference? So difference in the size of the cusps, right? Maxillary first and second premolars. Both cusps, that is buccal and lingual, are of equal height in the first premolar in maxillary. So we have also discussed this option in one of the previous questions, and we know that this option is incorrect. The second premolar usually has cusp tips closer in height, making the occlusal profile less clear. So we have also discussed this option that the cusp of maxillary second premolars, they are almost of same height, isn't it? And it also appears rounded. So both the portions of this statement are correct. The first premolar has no transverse. Again, this is incorrect because it does have a transverse, while the second premolar does. So second premolar also has the transverse and the first premolar also has the transverse. Neither premolar exhibits central. Again, this is incorrect because the maxillary first premolar has a long central groove, and the maxillary first premolar has a long central groove, whereas maxillary second premolar has a short central groove, right? So it is not absent in either of these. It's just that it is shorter on the second premolar and longer on the first premolar. So option B is your correct answer. The second premolar usually has cusp tips that are closer in height. So next question. Maxillary and mandibular arches differ in how their tooth crowns are oriented. Which of the following statement describes a general arch trait? So we need to find about the correct general arch trait. Option A, mandibular posterior teeth tilt buccally, while maxillary posterior teeth tilt lingually. So this option is incorrect, isn't it? And exactly opposite of what actually happens. The maxillary posteriors, they tilt buccally, and the mandibular posteriors, they tilt lingually. So option B, let's go to option B. What does option B says? Maxillary posterior often have a buccal inclination, and the mandibular posteriors, they have a lingual inclination. So yes, this option is correct. Option C, anterior teeth in both arches are upright with no labiolingual. So do you think option C is also correct? Do you think the anteriors, maxillary and mandibular, are upright? Do you think that they are upright mesiodistally? Do you think they are upright labially? Option D says no consistent arch-wise inclination differences are recognized in typical dentition. So obviously there is a difference. So option D is incorrect. And as for option C, this is also incorrect, isn't it? So none of the anteriors are upright labiolingually. They all have slight lingual inclination or lingual inclination. That you need to find out, right? So next question. Maxillary first molar commonly presents 4 major cusps, but their distolingual cusp can vary. Yes, we know that. Distolingual is the secondary cusp, isn't it? And it decreases in size from 1st to 3rd molar. So which statement about the distolingual cusp is most accurate? And I think I might have already answered this question. So option A says that distolingual cusp is always the largest cusp on the occlusal table. So obviously this is incorrect. Why? Because which is the largest cusp? The mesiopalatal or the mesiolingual cusp is the largest, isn't it? And the distobuccal is smallest in maxillary first molar if cusp of Caribelli is absent. But if it is present, the cusp of Caribelli is smallest. If present, cusp of Caribelli or CC, as I have just written, is smallest, isn't it? But as you move posteriorly, the distolingual becomes the smallest cusp in upper 7 or 8. Clear? So it often shows a groove called the distal oblique groove that continues onto the lingual surface. When the distolingual cusp is absent, it is replaced by an enlarged cusp of Caribelli. But obviously this is wrong. The distolingual cusp usually bears the thickest enamel among all the cusps. This also has to be followed. Distobuccal cusp. The distolingual cusp is the it is the secondary cusp, isn't it? So obviously option B is the correct answer. And as you might have noticed, the occlusal surface or the occlusal line of the first molar, there is a groove. There is a groove just distal to the oblique ridge, right? So let's say this is the distolingual cusp, and there is a groove here which is called the distal groove, distal oblique groove, and this continues here as the lingual groove. It continues on the lingual surface as the lingual groove. So basically, lingual groove is a continuation of the distolingual groove, distal oblique groove, or you can say distal oblique groove and lingual groove are joined, right? So distal oblique groove that continues onto the surface. So option B is correct. So next question is, the mandibular first molar typically has 5 cusps. Yes, it is correct. Which statement about its distal cusp is true? It is usually the largest of the 3 buccal cusps. This is false because it is this all the 5 cusps. It is positioned smallest hota hai, smallest cusp. It is positioned slightly more buccal than the distolingual cusp. So here you need to read the statement properly. It is not the distobuccal, but it is the distolingual cusp. It is true. And sometimes it is called the distal buccal cusp. This is also correct. So option B is correct. Option C, it has no occlusal contact in normal central occlusion. Why would that happen? That is seen only in non-functional cusps, like the lingual cusp of lower first premolar or the cusp of cerebellum, which are non-functional cusps. Non-functional in the sense that they do not reach the occlusion. It frequently fuses with the adjacent distobuccal cusp, forming a single large cusp. This again is incorrect because it does not fuse with the adjacent cusps. Some maxillary premolars can show a small tubercle on the mesial marginal or the lingual cusp. Maxillary premolars. Which statement is most accurate about these tubercles? So we know such a tubercle, that is dense vaginatus, which is seen on the mandibular second premolar. But we are not talking about that. We are talking about the tubercle that is seen on maxillary premolar, right? They regularly form a fully functional cusp that contacts the opposing fossa. Obviously, this is incorrect because we haven't read about any fully functional cusp developing apart from the buccal or lingual cusps, right? They appear most often on the maxillary first premolar. This is correct. First premolar's mesiolingual aspect, and sometimes called a mesial tubercle. So yes, option B is again correct. They occur exclusively on mandibular premolars, never on maxillary premolars. Again, this is incorrect. They frequently contain a pulp horn, making endodontic complex. Again, this is incorrect. They do not contain pulp horn frequently. They usually just snap on. In an ideal occlusal scheme, canines often help disocclude posterior teeth during lateral movement, that is canine guided occlusion. Which statement is true regarding the canine scheme? So option A says the mandibular canine is too small to provide any guidance. Obviously, this is incorrect because in the canine guided occlusion, the maxillary and mandibular canines contact, and that's how all the posterior teeth are disoccluded, isn't it? The maxillary and mandibular canines typically contact in lateral excursion, protecting posterior teeth from heavy lateral loads. With option B, this is correct. In canine protected occlusion, premolars and molars remain in contact. Incorrect. As I just explained, all the posteriors get disoccluded. They are out of occlusion, isn't it? The canine guidance is rarely observed. Again, this is incorrect. It is not rarely observed. This is commonly observed, right? Because most adults have lost canine vertigo. Obviously, the statement is incorrect. Now, the last question for today: group function is another occlusal scheme used in some patients. Which statement most accurately describes how group function differs from canine guidance? What happens in group function is that all the teeth from canine to molars are in contact in lateral movement We are all in contact in lateral movement. Clear? So all teeth on a working side share contact during lateral excursions during lateral. So this is exactly what I have just described. So obviously option A is the non-working side canines alone handle all occlusal loadings. So as I have told you in class, there is no contact, there is no occlusal contact on the non-working side, and if that is present, it is the most damaging contact in natural dentition, right? So we need to remove it. Only the posterior teeth contact while the interior remain distributed in lateral movement. Again, it is incorrect because canine is an interior tooth. So there is a contact from canine molars. So all the posteriors and canine are. Group function and canine guidance have the same concept. Again, this is incorrect because they are different concepts. In canine guidance, only the canines will contact. In group function, all the teeth, all the posteriors along with the canines will contact. Right? So this was all for today. Is there anything that you want? Is there anything that you would like to ask? कोई डाउट हो, कुछ पूछना हो? So okay, if you don't want to ask anything, we are done with the class. So good night and all the best for your exam.